morning, everyone. My name is Paige Roth. I'm a person in long-term recovery from a substance use disorder. For me, that means that I haven't had a drink or a drug since June of 2005. I am a licensed social worker and a certified recovery specialist here at Lehigh Valley Hospital, where I am an addiction recovery specialist, and I'm also program coordinator for addiction recovery services. So I'd like to thank Lisa Wolf, the Center for Humanistic Change, and L-Tri-C for inviting me to talk with you today. So to get started, a few years back I was asked to speak at another event, and in preparation I came upon a reading in the Daily Reflections, which is the AA members' reflection book. And it very well summed up my journey during my active addiction in a brief paragraph. So I'd like to share that with you. It's from February 7th. My last drunk had landed me in the hospital, totally broken. It was then that I was able to see my past float in front of me. I realized that through drinking, I had lived every nightmare I had ever had. My own self-will and obsession to drink had driven me into a dark pit of hallucinations, blackouts, and despair. Finally beaten, I asked for God's help. His presence told me to believe. My obsession for alcohol was taken away, and my paranoia has since been lifted. I am no longer afraid. I know my life is healthy and sane. So, without going into details, because we could be here all day, I drank and used a myriad of drugs for about 17 years. That's the number I think is probably the most accurate. And my recovery story actually began here, one flight up above us in the emergency department at Cedar Crest. And I came in severe withdrawal, dangerous withdrawal symptoms from alcohol. And what happened for me was I spent an overnight stay here in the hospital, and when I woke up, I was up on one of our medical floors. And I remember clearly a medical resident coming in and asking me how I was doing. And of course I wasn't doing well. But the next thing he asked was, well, he said, you can go home today, or we can keep you overnight again, and you can go home tomorrow. And at the time, of course I wanted to go home right away. But at that time, I didn't realize that encounter proved to be really a touchstone experience for me. And that it comes into play going forward. So I went on to slowly, the grace of God and the help of my 12-step fellowship and my sponsor and a large sober support group of other women in recovery, I was able to move forward finally without having to drink, without that obsession, that daily obsession. And soon after I got sober, I think I was about 9 months sober, I joined the network. I met a gentleman in one of our AA meetings who was a vice president here at the hospital, and he approached me one day after a meeting and said, hey, Paige, my executive assistant is leaving. Why don't you apply for the job? The benefits are good. And at the time I had probably a minimum wage paying position with no benefits. So I applied for the job and was able to start here in April of 2006. So, and he really took a chance on me, hiring me at 9 months sober. But, it was just one of those gifts that we call them gifts of sobriety. You know, and my sponsor always promised, as long as I don't pick up a drink, um, things will get better. And, you know, and she was right. So in this position, I worked for him, and the president of our medical staff. And at the time, it was a Dr. Matthew McCambridge, and he was chief of our ICUs at the time. And I remember he would come down to the office and ask me questions about, you know, patients he had who were admitted that were there because of drugs or alcohol, you know, and it seems to, you know, other people, these crazy things we do. And he would ask me, like, why would somebody drink, how could somebody possibly drink antifreeze? Well, because it has a lot of alcohol in it, and back then it had a sweet taste, so I've been told. So, you know, in my discussions with him, you know, and looking back on my experience then when I was a guest here, I realized that there really were no services available in healthcare, in the hospital, you know, around substance use disorder. And, you know, there was this huge black hole around patients like myself who come in, their lives get saved, and then they were discharged out the door with really no services. Sometimes they got a list of phone numbers, and you know, it really started to wear on me a little bit. And I mean, I knew in my heart of hearts that it wasn't right. I knew we could do much better because of all the wonderful things, you know, that happens here every day. You know, people surviving cancer and people having organ transplants. And yet here we had this whole group of patients with the same disease that were receiving no care for that disease. You know, when I was in at the time, and the doctor came in and asked me if I wanted to go home, the question should have been, oh my God, how can we help you? You know, if I had any other kind of disease, say diabetes, they would have certainly talked to me about my diabetes and my sugar intake, and I would have had a consult with our Helwig Diabetes Center, and the nurse would have talked to me about it, and the doctor would have talked to me about it. But, you know, it was like, it was just this elephant sitting in the room, and it was easier really to do nothing and to discharge us, and that needed to change. So with the encouragement and the help of a couple of my doctors, I applied to graduate school. I thought, you know, if I want to make any kind of change, I probably need to have a little bit of an advanced degree. I enrolled at Marywood University Graduate School of Social Work, and I began my journey towards learning as much as I could about the disease of addiction in the community, and how we treat it, why we're not doing more. And it was really quite an education. And I came upon, my favorite quote by Martin Luther King is, "Our lives begin to end the day we become silent about things that matter." And I love that, and I have it on my desk, I have it in my office at home, you know, and sometimes when we have hard days, I look at that and it reminds me that, yeah, we need to just keep plugging along, no matter how, you know, how difficult it can be, what barriers we run into, it just has to be done. So while I was in graduate school, I did an internship. I did a couple of them. One of them I did here at Lehigh Valley Hospital over at Muhlenberg in the Department of Psychiatry, in a department called PES, Psych Eval Services. So it's an area of locked rooms over in the Muhlenberg Emergency Department where people with mental health issues are often admitted to there, and there they receive services from a caseworker who comes in and you know, talks to them, finds out about what's going on, and then eventually they help place them at the level of care that they need. Often it's inpatient services for mental health issues. We have a really robust Department of Psychiatry here at the network. We have 3 inpatient behavioral health units, 2 of them on the adult side, and we have 1 for adolescents. Now, what I learned during that internship was that we exclude patients who have a primary diagnosis of substance use disorder. We exclude them from being admitted to those units. If their primary diagnosis could be depression, and then, you know, a substance use disorder, then they're eligible for admission, or a bed at a dual facility is found for them. And I was really I was shocked, and you know, and I couldn't understand why this would happen. And I was actually told that the evidence-based research showed that people don't get help unless they make the phone calls themselves, unless they go home and take the steps on their own. And what I did with that information was I sent an email to William White, who is, many of you might know Bill White. He is a researcher, an author, and I often joke that I would not have made it through graduate school without Bill's research. You know, when I read it all the time. He has a wonderful blog called The William White Papers, where if you need any topic about addiction, recovery, it's on his blog. He's amazing. So I thought, you know what, I'm going to ask him about this. So out of the blue, I just sent him, I thought, well, it can't hurt. I sent him an email, and I said, I told him who I was and what I was doing, and I said, I was told that, you know, the research shows patients don't get help unless they make the phone calls themselves. And he replied in about 10 minutes, and he said to me that the absolute opposite is true. People recover no matter how they get into treatment or what pathway to treatment they take. They have the same chance of getting sober, whether they're court mandated, whether their family does an intervention, or if they make the phone call themselves. So I thought that was really interesting. And when I left that internship, I kind of vowed that, you know, I'd be back. I wanted to do something about this because it was not right. It clearly became a social justice issue for me. You know, when it comes down to stigma, and really, my people like me, patients with substance use disorders, were really being discriminated against with the lack of services and really the lack of help. So, you know, I mentioned the stigma, and I have a great definition of stigma, that it's a multidimensional concept that can manifest itself in a variety of ways. So there's a label and a stereotype. So the label, for example, addict, junkie, links the person to a set of undesirable characteristics, for example, criminal, dirty, immoral, untrustworthy, that work to form the stereotype, which is a belief held by a group of people with a substance use disorder, or beliefs held about a group of people with a substance use disorder. And, you know, and that's it in a nutshell. And we need to work on challenging that stigma. And, and and it's not easy. But about the time I was graduating from school, it was about 2013. I came upon the movie The Anonymous People, and it had just been released. And if you're in recovery or you want to learn more about recovery, I highly suggest reading or watching The Anonymous People. You can stream it on Netflix. It changed my recovery, and I honestly believe I wouldn't be sitting here today if it hadn't been for that movie. It really kind of spurred me into action. And what I did when I finally got my degree is I started to do volunteer work in the recovery community. I got involved. I wanted to meet other people who were doing this work, and we did some showings of the Anonymous People, and it really helped. It really helped ground me in the fact that I needed to do this, that we needed to speak up as a group of people who have this illness that needs to be addressed, and it needs to be addressed across the board in all areas, including, most importantly, I think, healthcare. So during one of my ventures, I was attending some town hall meetings that were pretty popular back then when we could all get together. And I saw a panel presentation, and one of the gentlemen on the panel is a doctor by the name of Robert Cannon. And he is an emergency physician here at the hospital and a medical toxicologist. And I listened to his presentation. It was wonderful. And afterwards, I accosted him. I ran up to him and I introduced myself, and I told him I worked here, but as an executive assistant, and I was interested in maybe doing something in the emergency department, like at least being able to have a conversation with patients about, there's hope. If I can do it, you can do it, and help move them to the next step, to find a level of care out there that's going to work for them. So Rob suggested that I contact Dr. Jennifer Stevens, who is, she's the chief medical officer in our Lehigh Valley Physicians Group. And she had started to do opioid stewardship work. So about this time, the opioid epidemic had surfaced, and we knew in the recovery community it would have been happening for a long time, and it was really being ignored. And then eventually, I hate to say it, but white kids in the suburbs were dying from these drugs, and it became major news. So of course, as healthcare providers, they treated pain, and they used Oxycontin and a couple of other really strong, powerful drugs that young people were getting addicted to after a knee surgery. They were given these medications, in good faith. None of this was done intentionally. And we really didn't know the serious effects or the seriousness of the addiction that was rampant. The dependence on these drugs was just incredible. And so Dr. Stevens was working on formulating plans for the network and the doctors on how to go forward and practice safe prescribing. And it was a huge initiative. It's still ongoing and always kind of changing, but compared to where we were back then in, say, 2015 to today, it's incredible. the safeties and the precautions that are safety nets and the precautions that are put in place to make sure that our patients don't develop a dependence on opioids and then have to eventually turn to street drugs like heroin and fentanyl. So I asked Dr. Stevens if I could meet with her for a couple of minutes, and she graciously said, yes, please. I went to see her, and I always kind of joke, I drug my soapbox into her office, and I gave her my spiel. I told her about my experience in my internship and how there's this huge dearth of any kind of services for patients with substance use disorders, and it's not right. I felt it was an ethical issue. So we had a nice chat. She agreed with everything I said. She understood. And I said, really all I want to do is be able to have a conversation with patients who are in the emergency department and need help. It's that, you have that small window of time when they're still desperate and in pain. And, if we can go in there and help them through it and to identify, I know what it's like to be that person, to give them some compassion and empathy. And so she said, I agree, we should be doing that, but there's really no money for it. And then another a God moment, a few weeks later, she emailed me on a weekend and said, hey, we've located some money that needs to be spent, hasn't been allocated anywhere. It was through one of our funds, endowment funds, and she said, could you write a grant proposal, and then we can use this money to start seeing patients, doing what you wanted to do. So I did that, and we got a small little nest egg of a little over $20,000. And in October of 2016, I started seeing patients in the emergency department. And I remember I needed a supervising physician in order to be able to work in the ED. And I remember I asked Dr. Cannon, because he was a toxicologist, and I heard his presentation. I asked him if he would be my supervising physician. He graciously agreed. We got together to sign the paperwork, and I remember at the end of our little meeting, he said to me, Paige, I really don't know anything about addiction. And, he went on to explain, which we know now, is that there was very little training or education about substance use disorder in medical schools. That is thankfully changing. So I have to tell you now, 4 or 5 years later, that is certainly not true. Dr. Cannon is an expert in addiction medicine, and it's been really fascinating and so encouraging to watch the change in my network. And I'm so proud of the work that we're doing. About the same time in 2016, when I started seeing patients, we had a new physician join the staff. Her name is Dr. Jillian Beecham, and many of you might know her. And the first night I met her, it was in the emergency department. Somebody introduced us and said, hey, Paige, here's Jillian. She's one of our new toxicologists. And we sat down and we chatted for a while, and I couldn't believe, where'd she come from? She was talking about doing MAT and harm reduction, and it was, a gift from God. Here she is. And I have to tell you, she told me some things that night that she wanted to do, like medicated assisted treatment for our patients And I remember thinking to myself, oh yeah, that's a great idea. But I didn't foresee that happening. Little did I know Jillian. So what happened as we continued to do this work, the toxicology team, we have 7 toxicologists on staff, and eventually, with Jillian's help, guidance, perseverance, we were able to start administering medicated assisted treatments here in the hospital, in the emergency room, and up on the floors for patients who come in who are in withdrawal, are using incredible amounts of drugs and alcohol. So briefly, the medications that we provide here are buprenorphine, which is commonly known as Suboxone, which is a partial opioid. It actually sits on the opioid receptors, yet it contains naloxone, which is Narcan. So the patient isn't going to get high, but it reduces cravings and withdrawal symptoms in a matter of minutes, and without producing that sense of euphoria. So we also administer naltrexone, which is an opioid antagonist, which sits on the opioid receptors and blocks opioids. So it's also used for alcohol use disorder. We prescribe it all the time, daily here. What happens is our team of toxicologists sees patients with substance use disorders and has a long conversation with them about these medications and and the services that need to come with them. And then I'm consulted, or that's our certified recovery specialist, Holly Maddox, who I work with. One of us will go and see the patient and then try and ensure that they get connected to services on the outside where they can continue to receive their MAT, but also receive counseling services and any other help they may need. We also have a connections clinic where one of our OB-GYN practices works with pregnant women and postpartum women who have opioid use disorder, and they prescribe MAT, and they follow up. They provide wraparound services. They also provide a certified recovery specialist, which is really amazing. Going forward, actually started last month. We have an incredibly forward-thinking Department of Family Medicine, and for years now they've been training their residents about addiction and substance use disorders, and now their physicians, their family medicine residents, are being X-waivered, which means they will also be able to prescribe Suboxone and naltrexone. And one of the drawbacks with these drugs is that not everybody can prescribe them. You have to have a specialized training. I think 8 hours for physicians, 16 hours for PAs, and you have to go through this process in order to be quote unquote X-waivered so that you can prescribe these medications. So our Department of Family Medicine has recently received a federal grant where we're going to start integrating addiction medicine services into the realm of family medicine. So now when we have a patient who is in the hospital, really needs help, can't go to inpatient rehab for whatever reasons there are, and we're able to start them on Suboxone here, or naltrexone, and then refer them to one of our family medicine practices where there's a doctor who can prescribe, and they have behavioral specialists who can help the patient. And part of this federally funded grant program is that it's mandated that we provide certified recovery specialists. They have to be available to these patients in the practices. So this is really exciting, exciting news, exciting work, and it's been such a pleasure to watch transformation and really like the education and the growth of understanding amongst our medical professionals around substance use disorder. It's so encouraging. We have 2 toxicologists where they're doing their fellowship. So they're board certified emergency medicine physicians, but now they're doing a fellowship in medical toxicology. We work with them, Holly and I do, daily, and they are, they're the power behind these programs, and getting the word out that we're here, we're treating people with substance use disorders because it's the right thing to do, and we can do it, and we're pretty good at it, and we're getting better, and it's just been really a wonderful journey. At the end of that presentation I mentioned earlier, I did another little reading, and it kind of, I think, for me, and I know the people that I work with here who do this work feel the same way, and there is no political meaning behind it, but I want to share it. We are not liberal snowflakes. Our feelings aren't fragile. Our hearts aren't bleeding. We are badass believers in human rights. Our toughness is in tenderness. Our strength is in the service of others. There is nothing more fierce than formidable, unconditional love. There is not a thing more courageous than compassion. But if our belief in equity, empathy, goodness, and love indeed make us or people like us snowflakes, then you should know winter is coming. And I think I'll end on that.